Hello and welcome. My name is Janelle Marzai. I am the Healthcare Facilitator at UCSB. Thank you for joining us today. We're going to be reviewing the retiree open enrollment highlights for 2025. Open enrollment starts Thursday, October 31st at 8 a.m. and ends Friday, November 22nd, 5 p.m. Pacific Standard Time. All current medical plans will continue in 2025. For a more detailed overview of our non-Medicare plans, please see our medical plan and non-medical plan changes presentation. I will primarily be discussing our UC Medicare plans. Open enrollment frequently asked questions. If I like what I have, do I need to do anything during open enrollment? No. If you like what you have, you don't need to go online or make any changes. When do open enrollment changes become effective? January 1st, 2025. How do I enroll or change my medical, dental, or legal plan? You can sign in or register at UC Raise, or you can contact RASC. Okay, open enrollment changes for 2025. You make your changes on UC Raise. Be sure to review your confirmation statement in your UC Raise messages. No online access, logged out of the website, call the retirement center at the 1-800-888-UCOP and dial 8267 and I'll direct you to someone to unlock your account. For Medicare members changing medical plans, to complete your enrollment, you must submit the Medicare assignment forms for your new plan via UC Raise, fax, or by mail. Every person you enroll must complete a separate form due to UC by Monday the 25th, 2024. As mentioned before, all non-Medicare plans and Medicare plans remain the same in 2025. Please keep in mind that if you switch Medicare plans, you must also remember to complete the appropriate UBIN form and return to RASC. The partner plans for split families will also remain the same. Again, please keep in mind that if you switch partner plans, your Medicare eligible family members must also complete the appropriate UBIN forms and return to RASC. Medicare retirees outside of California. Your benefits will be administered by VIA Benefits. All covered family members must be 65 and have Medicare. This does not affect dental, vision, and legal coverage. UC provides premium support, a health reimbursement account at HRA, $3,000 per covered person, each starting in January, that is subject to graduate eligibility. Use HRA money to buy Medigap or Medicare Advantage plans, pay for Medicare Parts B and D, and catastrophic coverage special payments for pharmacy. Medicare and UC. Medicare is a federal health insurance program for those over 65 and some disabled. Part A is for hospital and it's premium free for most. Part B insurance is $174.70 a month if newly enrolled in 2024. Please keep in mind that this is subject to change. The Social Security has not posted the new rates for 2025. Medicare Part D. Most UC retirees don't pay an extra premium for Part D coverage. You may pay a premium if your income is above a certain dollar amount. In all UC Medicare plans except UC prescription PPO without prescription drugs, your Medicare Part D coverage coordinates with your UC medical plan. Duplicate Part D coverage is not allowed. Medicare and UC plans. There are two ways to coordinate. The first is to keep your Medicare, which is original Medicare, with a supplemental plan. Medicare will be your primary and Anthem Blue Cross will be your secondary. Medicare providers must be used. 99% of U.S. doctors are a part of Medicare. 96% of U.S. physicians participate in Medicare and do not balance bill. Providers that do not accept assignment can charge up to 15% more. Providers who have opted out of Medicare are not covered. The second way is to assign your Medicare to an Advantage plan, which are a Medicare Advantage plan, the UC Medicare PPO, and Kaiser. You must sign over your Medicare benefits to a plan by form. Use Plan ID card instead of Medicare card. Medicare pays a flat monthly fee for insurance company, and Medicare cannot be used separately from Medicare Advantage plan. Let's review our Medicare and non-Medicare PPO plans. The UC Medicare PPO coverage is Original Medicare, Medicare PPO Secondary. Caution, must use Medicare providers. The exception is mental health providers unless not covered by Medicare. Deductible only applies if not covered by Medicare, but covered by the plan. Must use Medicare providers for non-behavioral health services. Diabetic supplies, Medicare Part B must be billed first, Navitus second. $2,000 cap for pharmacy out-of-pocket max for prescription drugs. The deductible is $100 and the out-of-pocket max is $1,500, and that remains the same as last year. When Medicare is your primary, authorization is rarely required. Use any Medicare provider for Medicare covered services. Use any licensed provider for behavioral health, comprehensive worldwide coverage, acupuncture coverage, hearing aid coverage at 80%. Skilled nursing facility care. Must meet Medicare's requirement, including having been in a hospital at least 3 days and entered a Medicare approved facility within 30 days after leaving the hospital. The UC High Option Plan. For most services, plan pays 100% of the balance after Medicare. You pay nothing. $50 deductible, 20% coinsurance applies only to services not covered by Medicare, and the example would be acupuncture. Live Health Online Telemedicine Psychology, $20. Original Medicare Primary, UC Health Option Secondary. Must use Medicare providers, exceptions for benefits beyond Medicare. Deductible only applies if not covered by Medicare, but is covered by the plan. $50 deductible and $1,050 for out-of-pocket max, and that remains the same as last year. UC Medicare PPO and high plan option changes. New, there will be an increase in copay for all pharmacy drug tiers. There's going to be a new Tier 4 specialty drug tier. It will be $35 per drug, 30-day maximum, and a $2,000 out-of-pocket max for drug cost. New, the Medicare PPO and high option plan pharmacy benefit copays. As you can see, there has been an increase in copay across all drug tiers. Let's have a quick overview of our non-Medicare PPO plan changes. For UC Care PPO, there will be a copay increase for office visits, specialists, rehabilitation, behavioral health, and urgent care. Pharmacy copay increase for each tier, and new Tier 4 specialty drugs. No change in the deductible and out-of-pocket max. For our health savings plan, there's an increase in HSA contributions for self and family coverage. There is an increase in in-network deductible, and out-of-network deductible remains the same. Same catch-up contribution for members 55 and over at $1,000. Same UC contribution for the year, up to $500 for single and $1,000 for family. And for core, no plan changes. And then starting in 2025, core will now have a premium. Let's move on to the HMO and Medicare Advantage plan changes. For the UC Blue and Golden HMO plan changes, there is a copay increase for office visits, urgent care, and behavioral health. There is also a copay increase for all drug tiers. There's a new Tier 4 specialty drug tier, and that will be at 30% coinsurance up to $150 maximum per prescription. For Kaiser, there is an increase in copay for office visits, urgent care, and a copay increase for all pharmacy drug tiers. For Kaiser Senior Advantage Plan, there is a copay increase for office visits and urgent care for $30. A fitness membership is now included, and the membership with access to a wide variety of in-network gyms through the premium network. For the Kaiser Senior Advantage Plan, there is a copay increase for all pharmacy drug tiers. UC Medicare Choice changed to pharmacy benefit copays. As you can see, there has been a copay increase for each pharmacy tier. "2025 Medicare Part D CMS mandates Inflation Reduction Act provision for 2025 will cap the out-of-pocket prescription drug cost limit to $2,000 for Medicare Part D members, eliminate the coverage gap or the donut hole, and introduce an option to pay for prescription costs in monthly installments. Please contact your health plan to learn more about the prescription drug monthly installments if you have high pharmacy drug bills." Let's move on to medical plan premiums. UHC premiums are deducted from your UC pension. Medicare premiums are paid by you out of Social Security income or through Medicare Easy Pay or through quarterly billing. And this is something that you can set up on your Social Security account. How are your premiums calculated? If you have 100% of the UC contribution, please check the rate chart for graduated eligibility by logging into UC Raise, or you can call Brask customer service. And new this year, Alex Tool will now provide the cost if you have graduated eligibility for each health plan. 2025 plan costs for UC retirees. The next few slides convey monthly costs for medical coverage that applies to retirees eligible for 100% of the UC employer contribution toward the premium for each plan. If you are subject to graduated eligibility and therefore not eligible for the maximum UC contribution, your costs may be higher than those listed in this presentation. Here are the 2025 costs for retirees who are eligible for the maximum UC contribution and all family members are in Medicare. Due to the high cost of medical care, UC Medicare Choice Plan will now have a premium in 2025. Here are the 2025 costs for retirees who are eligible for the maximum UC contribution when one or more family members are not Medicare eligible. And finally, these are the 2025 costs for non-Medicare and who are not Medicare eligible. Again, these rates are for retirees who are eligible for the maximum UC contribution. If you are subject to graduated eligibility, you can view your rates via UC Rates starting October 24th. For our Delta Dental, there are no benefit changes for either the DPPO plan or the DHMO plans. No premium change for the DPPO plan, and the DHMO premium has increased about 3.4%. UC continues to pay the full cost of coverage for employees and retirees subject to graduate eligibility. For our Vision Plan BSP, there is a 5% premium increase for retirees, and there is no benefit design changes for 2025. There are no rate changes for legal, and legal is open during open enrollment. Fidelity. Andrew Fung is our location financial consultant. He can help you understand your retirement saving program, evaluating your individual situation and priorities, rollovers in UC retirement saving program, comprehensive retirement income planning, legacy planning, charitable giving, and tax strategies. Please contact Andrew via email if you wish to set up an appointment with him. For the first time, the Brask Insurance team will be hosting a virtual open enrollment office hours to assist retirees during the open enrollment process. This is a great opportunity for retirees to get answers to any questions they may have about completing their enrollment. Resources. Please check out the open enrollment website for more content and resources. Attend the open enrollment Brask Zoom office hours. And the Maritire Retiree Coordinator is Ellen Pasternak. And I'm Janelle Mirzai, the Healthcare Facilitator. These presentations will be recorded and posted on the Healthcare Facilitator YouTube channel. That concludes this presentation. Thank you.